My son is back to being the son I know. He's part of the family again.
I no longer spend my days trying to find money to buy drugs. I can do the things I need to do, pay my taxes, earn a living, and I contribute to my community again.
I don't have to arrest the same people again and again for petty crimes. We can spend our time and resources on more important things to keep our community safe.
Even though I'm HIV positive, I won't be passing it on to anyone else. I also feel like I can get access to the healthcare I'm entitled to without feeling intimidated.
Every time my husband injects drugs, he does so with a clean needle and he doesn't share it with anyone else. This protects me too.
The number of people in my country requiring expensive and lifelong treatment for AIDS is no longer rising. We are preventing transmission at the root.
Now my mom can pick me up from school and read me bedtime stories.
Harm reduction doesn't aim to stop people from using drugs.
It gives people alternatives so they can protect their health and the health of others to minimize the harms associated with using drugs.
Not just for themselves, but also for their families and communities.
Whether by supplying clean needles and syringes,
Or providing drug substitution therapy.
HIV testing and treatment and support.
It makes a safer, healthier and better place for everyone.
12.7 million people around the world inject drugs.
And outside of sub-Saharan Africa, that accounts for an estimated 30% of new HIV infections.
That doesn't include the thousands of people who contract HIV through sexual partners.
we have clear evidence from around the world.
That clean needles and drug substitution therapy can break the link between injecting drugs
And the spread of the HIV epidemic.
But whilst $100 billion
They spend every year penalizing drug users and moving them into prisons and away from health services with zero health effect.
There is a critical lack of funding for harm reduction programs.
We know that HIV prevention costs far less than HIV treatment.
One country showed that every dollar spent on needle and syringe programs
save $27 in healthcare costs.
The differences between countries who fully support and fund the harm reduction programs and those who don't speak for themselves.
It's time to stop punishing and start working together.